So I've now begun the live stream on YouTube, and we
Yeah.
can begin by 8:05. So we have around 3 to 4 more minutes to go.
4 minutes to go. Yes.
Screen share you tried?
Yes, we tried screen share.
Okay, yeah. That's good. Yeah. Good morning, Amin sir.
Good morning, everybody.
Good
Good
morning,
morning, Amin.
Hemant.
Good morning, Amin. Good morning, Amin sir.
Good morning, good morning.
Good morning.
Hiren bhai, you have dedicatedly done Smile Train work for almost now 2 decades or more now.
Yeah. It's basically a teamwork with full support from Jagdish sir.
And you have to travel, and you made so many friends and companionship with other plastic surgeons also.
Yes.
And that you shared with us friends. So we are proud of you.
Thank you.
नाही एकदा बघ आपल्या दवाखान्यात
Okay, so we shall begin now.
Okay.
Good morning, everyone. I am Chitra Pandya, and I'll be the one hosting today's meeting as my father, Dr. Satish Pandya, is traveling right now. Thank you for joining today's session. And today we have Dr. Hiren Kumar Bhatt as our speaker. Welcome, Hiren sir. I will give a brief introduction. So today's topic is From Cleft to Confidence, a comprehensive treatment journey. Our speaker is Dr. Hiren Bhatt, MS MCH. He's a consultant cosmetic plastic surgeon in India who has a vast experience and has been in practice since 1991. He established Nishtha Hospital in Vadodara, and he's also the section editor for Indian Journal of Aesthetic Surgery. He's affiliated with the Plastic Surgery Education Foundation Trust in the USA. He's also the project director and Smile Train program in USA at which is being run at KGP Children Hospital in Vadodara. He's also a member of the American Society of Plastic Surgeons, Association of Plastic Surgeons of India, and Indian Association of Aesthetic Plastic Surgeons. Thank you so much, Hiren sir, for volunteering to come to the Saturday Club as a speaker. We are all very fortunate to have you here. And I'll now hand over the stage to you so that you can go ahead with your presentation.
Thank you, Dr. Chitra, for the introduction. And I must thank Saturday Club for giving me this opportunity to deliver this talk. And this is the first time after the virtual Saturday Club. Earlier, I had appeared twice and delivered talks. That was in, I think, Koti at Dr. Satish Pai's clinic. So we have memories of that also. I'll start sharing my screen now and we will start the presentation. The screen visible? Okay. So basically, we are talking about comprehensive cleft care. So let me give you an idea of what we are going to talk about these today. So we'll be taking a brief overview of the cleft lip and palate deformity and its impact on the child and the family. We'll also discuss about what is this organization, the Smile Train is doing, its concept, the way it functions, the care it provides, and we'll also discuss about the partnership between Smile Train and KG Patel Children Hospital and other aspects of comprehensive care, such as what do we do at the time of birth, what is nasoalveolar molding, how do we take care of nutritional issues, what do we do about associated anomalies, and what are the surgeries involved, and how do we rehabilitate the cleft child into society. So basically in India, every year about 35,000 cleft children are born, and we have to, even if we consider the backlog, so there is a lot of work to be done in the terms of providing surgery and care. So cleft is a problem where there is a defect of tissue. Not only there is defect, there will be distortion of the tissue all around. Tissues are also displaced. And over a period of time during the development, the cleft side remains, it always lag behind the opposite side. So some kind of discrepancy will always remain. And that is the reason we have to keep treating these patients till they become adult, like anywhere between 15 to 18 years of age. Apart from social impact, the impact of the cleft on the child is nutritional issues. Because of cleft palate, children are not able to create a vacuum in the oral cavity, and therefore lactation is difficult, breastfeeding is difficult. uh, and because the child is not able to breastfeed, the mother is not able to lactate. So these are the things that we have to explain to the patient. The cleft lip is a problem of cosmesis, that it is a basically a deformity that makes the child child's look something not acceptable to the family and the society. If cleft palate is not treated properly, there will be speech issues, there will be dentition problem, and there are developmental issues also. So it's a long journey till 18, 20 years of age, and family needs to support the child throughout the journey, both socially and psychologically. And it has got a significant economical impact on the family, uh, especially because of multiple surgeries, multiple therapies involved. I'll just run through different types of clefts and preview. So basically, there are several genetic problems that can happen, but exactly science doesn't know the cause of the cleft, which can be pinpointed in each and every case. So unlike like all other birth defects, many of the features remain enigma, and we blame it on, say, folic acid deficiency or rubella virus or viral infection like that. But then there are cases like this. These two infants were brought to KG Patel Children Hospital. They are twins, and one of them, they are identical twins. One of them is having cleft, the other is normal. So there are issues which we still do not know about it. And these are the things when you do the surgeries, it can be easily corrected. The same child that we saw earlier in this, one of the cleft twin is after the treatment. It can also be part of the sequences in syndrome like constriction ring or amniotic band syndrome, Pierre-Robin sequence. So basically, normal lip and palate involves a good filtral column and a muscle running around it. If that is not there, there will be deficiency of the tissue. And normal palate will have a good. I'll go through it again at the later part of the lecture and explain what are the roles of each element in the speech. It may be a simple palate. It can be unilateral or bilateral. It can be bilateral incomplete, bilateral complete. It can be simply a cleft of the palate also, or it can be what is known as submucous cleft or subsurface cleft, wherein the mucosa or skin is intact, but the key element that is the underlying muscle is not intact, as we can see in such cases. So let's discuss about the Smile Train, what it is. It's an international charity based in USA. The Smile Train as a concept that there are so many problem in the world, but we will take care of only one thing, that is cleft lip and cleft palate only. And the charity is working in about 156 countries, present in India since 1999, and KG Patel Children Hospital since 2001. It believes in partnership, doesn't believe in coming getting the surgeons from US or other countries and operating the child which then go away. So they basically believe in partnership. They empower the local hospitals, ensure very high standards of safety and quality. Quality is ensured by grading each result through what is known as Smile Train Express. It is a database, it's a computerized system. We have to upload each and every detail of each and every case we operate, including pictures before the surgery and after the surgery. And on the basis of these, with the help of AI, the computer will generate grades from 1 to 5 for each and every patient. And whenever there is a fall in the grade below 4, the smile train will ensure that the surgeon, especially junior surgeons, is given a talk, or he is even exposed to other centers, he is even exposed to live workshop, so that whatever things that needs to be learned can be taught to the surgeon. Safety standards are very high. We have to have complete data, just like an American organization. Anesthesia details are to be uploaded every time. All the team members need to be credentialized, and whenever required, additional training is provided to the surgeon, anesthetist, orthodontist, speech therapist, and even nursing staff. Our nursing staff has been trained by Smile Train, the ICU staff, the ward staff, the theater staff, to take care of the cleft children, and that has helped us not only in taking care of the cleft children, but all post-operative patients who are being operated at KG Patel Children Hospital. Thanks to the management and thanks to the Smile Train, we have high-end equipments in our operation theater. These are the anesthesia machine. This is fiber optic uh, uh, laryngoscope for intubation of cases with difficult intubation, recently acquired by our hospital. I'm really thankful to the management of KGP Hospital, Dr. Jagdish sir in person, and the Cleft care team that because of the smooth functioning of us, we remain a very old and valuable partner of the Smile Train. So what is comprehensive cleft care? As we saw earlier that there are multiple problems affecting the child, and we have to involve so many specialties and subspecialties, beginning with pediatrician, plastic surgeon, oral maxillofacial surgeon, orthodontist, nutritionist, speech therapist. So how it is provided? It's a structured protocol-based team approach, and we were doing this at Patel Children Hospital, but now Smile has started funding us, and we are the only center in Western India where we have been approved for comprehensive cleft care because of the infrastructure available. So we take care of all the specialists during this surgery. And as we know, the operations for cleft lip and palate is only a one part of the complete management. The lip is to be operated to make for making the child cosmetically normal, and palate is required for the surgery is required for the normal speech development. There are so many other surgeries. We will not go into details of each and everything, but we will take care of the steps of the comprehensive surgery. So whenever the child is born, we, as I told you earlier, we have to explain to the parents, explain to to mother especially how to feed the child. So children have with cleft, especially the cleft palate, they will have a lot of feeding difficulties, and there are these issues are because of the child not being able to create a vacuum while doing the breastfeeding. And this led to delayed milestone, poor weight gain, delayed development, and then it will all lead to delay in surgery, and ultimately the result will not be good. So it is important that nutrition counseling is done and intervention is done in a way that it becomes really smooth for the parents as well as the children. At our center, we have protocols established for the children who visit us immediately after the birth with cleft palate or without cleft palate, only having cleft lip. That we inform the parent, explain about the deformity and the course of treatment. Mothers are counseled about the feeding, and we also tell them how to visit us for various measurement of various parameters. And they are most of the time they are able to understand it, they are able to do it, and they are able to even do follow up with this also. The first visit, like this is what we do, and the nursing staff does this to a group of patients that we see in explainer. With the help of graphics, they explain to this patient. We also now have videos of children who are how to feed them so that we can share it on WhatsApp. Or most of the patient, even if they are coming from the remote area, they have the smartphone and they have WhatsApp. So that's a really beneficial to us. We share our feeding videos to them on WhatsApp, and they are able to go through it. We registered various parameters like birth weight, height, mid-arm circumference. We take pictures, we record this, and we record this at every visit so that we can understand what is the progress. Uh, we have a nutritionist who will, as I told you, will take, and she and the nurse will take care of all these information to the patient. Pediatrician will do initial nutritional assessment and recording of the patient's systemic examination. The nutritionist will do the patient counseling, explain the feeding methods and all other details. Surgeons will communicate about the findings of the surgery and the timings of the surgery. Demonstration of various procedure and patient care is explained by the nursing student. So if the patient is coming with a for the first time, if the patient weight is normal, we do the counseling, weight monitoring, record the parameter, keep the child health, following up to see that it doesn't go beyond the below the ideal weight, and we do the surgery. If the patient at the first visit is having poor weight, the pediatrician is getting involved, dietitian gets involved, surgeons also will help involved, and a nutritional strategy is brought in to get the child above the ideal weight. At the same time, there are certain conditions, systemic conditions where such as congenital cardiac anomalies. All this is also evaluated during the first visit if the child is having an issue of gaining weight or child is significantly underweight. So we have OPDs of all the specialists in the same day and the same physical zone where each OPD is having very close to each other. And once in a month or two, we do a roundtable discussion of cases that require special attention. Our after the nutritional assessment, the next step is for those who are having cleft lip and palate, pre-surgical nasoalveolar molding, or NAM as it is known as, also known as pre-surgical orthopedics. Basically, it should start at birth, but at least not later than 2 months after the birth. Then it's important that we understand that when the child is born, there is maternal estrogen and maternal chondroitin sulfate in the cartilage, and this helps in remolding the tissue. So this is the advantage of nasoalveolar molding, and it aims to reduce the gap of the cleft as much as possible before the surgery for better outcome. It also shapes nose to a more aesthetically acceptable shape, so that primary surgery on the nose, the magnitude of the surgery, it reduce. It is not done for improving the feeding, and there is a obturator for over the cleft to facilitate feeding. It is primarily outcome of the surgery. So here is a case of nasoalveolar molding done our hospital. You can see the cleft shape of the cleft lip at the time of birth, and then after 3 months of nasoalveolar molding. These are the kind of support that is given to the child. Gradually, this is increased so that the height of the nose becomes acceptable. And finally, at the time of surgery, this is what we get from here to here. Then there is interventional orthodontic that is generally starts at the 6 to 8 years of age, and dentition in cleft children is quite mutilated if not treated. So intervention at this age corrects the basic deformities of the children. It takes care of the collapse of the arch, alignment of the teeth, correction of the alveolar gap, and prepare the alveolar gap for the bone grafting or orthodontic treatment. The fixed orthodontics and intraoral oral appliances are also applied at this stage. So this orthodontic treatment can last up to 1.5 to 3 years, depending on the kind of deformity that the child is having. And we have three orthodontists on our team. And currently, there is a significant load. About more than 200 people are undergoing orthodontic treatment at our center. And we take care of all the problems. These are the kind of the thing that we can achieve at the end of it. The gap which see in between the teeth is first bone grafted, and then after that we are able to either put a dental prosthesis like ceramic teeth or something like that. And finally, we are able to give a picture like this. So the first the 3 weeks timetable is like as I said, nutritional, taking care of hearing, genetic counseling, impressions, dental impression for nasal molding, and explaining the patients about the consequences. At the age of 3 months, we do the lip repair. Between 8 to 12 months, cleft palate repair. Frequent TNT checkup is done because cleft palate, because of the cleft palate, the eustachian tube function is not normal. And when eustachian tube function is not normal, there can be middle ear collection. We have to keep seeing the children regularly for this. And if there is middle ear collection, we insert grommet, that is a kind of a wall like thing, which allows the middle ear collection to come out into the external ear. Then we do the periodic checkup for hearing, dental, social, and emotional development between 12 months to 5 years. Then there will be orthodontic treatment, bone grafting, definitive orthodontic treatment, rhinoplasty, and orthognathic surgery. Now coming to the most important part, why do we repair a cleft palate? Leaf, we know that it is for the cosmetic reason, but to understand the importance of having a normal cleft palate, we need to understand the normal speech part, and we need to analyze what goes wrong. So this is the soft palate, and this is the pharynx, and this is the larynx. These are the three important aspects of a speech production. When we speak, the soft palate touches the pharyngeal wall. The voice that comes out from the larynx goes to the pharynx and comes out through oral cavity. That is why we have a clear oral voice. We do not have any nasality in the voice. And that is what is the importance of surgery. In the case of cleft palate, the soft palate is not touching the pharyngeal wall. So whenever child starts to speak, this voice can come from the oral cavity as well as nasal cavity. Because of this, there is a nasality in the voice, and there will be like child speaks from the nose, not from the oral cavity. And there will be also important problems with the pronunciation. These are the muscles which are responsible for lifting up the soft palate to the oral cavity, to the pharyngeal wall at the time of speech. And it is important that these muscles are repaired. Simply explaining you by this video, you can see the soft palate touching over the pharynx. So if the palate is properly repaired, there will be very good speech, and I can, she is the girl who has undergone surgery.
Sir, I think you will have to share the audio as well from your end.
You're not able to have the audio. I am sharing already.
No, sir, we are not able to hear
You're
the
not able to
audio.
hear?
No, no.
Check how do I do?
Sir, in your screen share the top panel, there will be 3 dots on the right end. If you click on that, it will give a drop down menu. There you'll have an option of ticking that share audio
Yes,
of the
yes.
screen.
Is it audible now?
Yes.
Audible?
Yes, sir. It is
Yes, it is
audible.
audible now.
Okay, okay, okay.
પાવભાજી પાણીપુરી એવું ભાવે હું બોલું એમ બોલજે હા સવારે સુંદર સૂરજ ઉગે છે.
So this is the outcome of surgery as well as a lot of effort on the part of speech therapist who guide the parents about the therapy, speech problem, and I would also appreciate the involvement of parent in this case. Even if the cleft is only a minor one, the speech problem could be a major one. And when we treat the cleft palate, we have to repair the underlying muscle so that the child becomes develops a normal speech. And this is the level where we repair the underlying muscles. What is velopharyngeal dysfunction or VPD? Here, even after repairing the palate remains small or short, and there will be significant air leakage from the nose, and child is not able to speak properly. This girl operated earlier for cleft palate.
My name is Khushi Chawla. I'm studying first year and
There is distinct nasality in this
Okay, and
case.
where do you stay?
I'm first
First year?
first year
And what's your college name?
Vanita Mishra on it.
Okay, and what are your college timings?
7:30 to 12:30.
Okay, great.
My name is Khushi Chawla.
So how do you take care of it? There are ways of doing investigations and treatment of this. One of the modality is to do nasoalveolar or nasoendoscopy, wherein an endoscope is inserted into the nose and the movement of soft palate is examined through the endoscope on the computer screen as seen in this. Now, this is a very difficult situation. It's not an easy task to get the cooperation of the child uh, for this kind of intervention. So what we have done is we have come up with a solution, that is video fluoroscopy. This is a cath lab, and we take the child to cath lab, and I'll show you how the video fluoroscopy shows us the movement of the movement of the soft pellet so clearly.
બોલ પાપા પા પી
Can
પી
you
પી
see here the soft
પે
pellet?
પે પે
It's
બા બા
not
બા
touching the pharyngeal wall.
બી 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 બે 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 સરસ્વતી 66 મારું નામ નિધિ છે
Here, child doesn't have to undergo any injection, anything, just screening with the help at the cath lab with their system is done. And
બોલ પાપા પા
it gives us the measurement for how short is the pellet at the time of at the resting stage as well as at the time of peak. This gives us an idea of, say, we have to lengthen the pellet by this many centimeters. So we, after having this thing in our knowledge, we do the surgery for lengthening the cleft pellet. And this is the for that we do the local flaps from the cheeks and lengthen the pellet. And after the surgery, like this, we open up the pellet, see if the muscles are repaired, and extra flaps are inserted from the cheeks. And what happens after the surgery? This is the case that we have done. This is before surgery.
60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70.
And the same child 6 months after surgery and speech therapy.
61, 62, 63, 64, 65, 66.
So there is near normal speech after this, and this is what we have been doing for the video fluoroscopy. We have tied up with Tricolor Hospital, and they have been generous enough to do it with a very nominal charge, and that charge also is borne by K.G. Patel Children's Hospital for the patient. Entire treatment right from birth to adulthood remains free, either because of Smile Train's funding or because of the hospital for K.G. Patel Children taking care of it. So basically, in this velopharyngeal dysfunction, speech assessment is very important, and that's why we take care of this after doing video fluoroscopy and selecting the right procedure, do the surgery where the assessment, doing the surgery without the assessment is absolutely of no use, because it will not give us an idea how much lengthening is required, and then we have to evaluate the results. So basically, the whole thing is to get the child to a normal speech issue, near normal speech, and getting them back to society. So from cleft to confidence, so this is the unique initiative that this organization Smile Train has recently taken up. That surgery's treatment is only one thing, but then psychologically patient should be able to get back into society with confidence. So Smile Train recently conducted what is known as Cleft Con, that is from Cleft to Confidence, a conference where Cleft warriors, these children who have achieved something significant in their life despite having cleft, they provide motivation to the patients and parents who are having cleft children, cleft. So basically, they collected almost 100 to 150 children and their parents to whom from various part of Western India. And there were talks, motivational talks. There was guidance provided by the other CLAP children who were some achievers. Like there was a maxillofacial surgeon who had clapped, so he gave guidance as to how to overcome. There was another Bollywood and OTT platform, Sarika Singh. She is a cleft child and she has done a lot of serials and movies, and currently she is there in the a very popular OTT platform show Saas Bahu or Flamingo, if someone is watching it. So she gave a motivational talk. There is another girl, she is Dr. Nileshma Singhal. She is a cleft child. She is an MBBS. She became gynecologist. She is now pursuing fetal medicine at Harvard, and she is doing research on intrauterine surgery of cleft, so that child is not born with cleft, uh, and the thing is taken care of during the pregnancy itself. So to conclude, we have to have a patient-centric approach instead of cleft-centric or surgery-centric one. And us is the only center in Gujarat to be selected for the comprehensive care of cleft lip and palate by Smile Train. And we are happy and proud of what we are doing. And we are also thankful to all those people who have supported us, not only from within the hospital, but from outside, our pediatrician colleague, gynecologist colleague, and all other medical consultants who have sent the patient, who are the NGOs and social workers who have been sending us the patient. Thank you so much for your patient hearing.
Thank you very much, Hiren sir, for this very, very informative session, especially with all the images and the videos. It gave a very keen insight into the kind of work that is being done. And now I'll open the forum for Q&A. But before we go ahead, I would like to invite Dr. Jagdish Patel sir to actually give his comments and moderate the Q&A further. Thank you.
Thank you, Chitra. I would like to start by remembering late Mr. Satish Kalra, who was Asia Pacific Chief of Smile Train, and he met Dr. Hiren in one of the pediatric conferences, where he asked him whether he would like to start such a center in Gujarat. So Satish Kalra came to Baroda, stayed in a hotel. He spent 2 days. During 2 days, he interviewed first trustees of the children's hospital. What kind of work and what is the objective of the trust and how we are functioning. And then later on with plastic surgeon, anesthetist, and infrastructure. The Smile Train project itself is a very unique model of its kind. If somebody wants to do a voluntary work charity, follow. Luckily, the funds come from US donors. Now they are looking for local donors also. And having this conference in Pune, Cleft to Confidence is one of the objectives, to invite local funding agencies also to donate into the Smile Train project. But it's an excellent teamwork. Dr. Hiren Bhatt, Dr. Kalhan, Dr. Falguni, Dr. Hitesh Desai. It's a teamwork and it's an excellent model to follow.
Thank you,
I
sir,
think
for
I think Dr. I.C. Patel sir was the president of IMA when the project was launched, and he was there at the time of its launching, if I'm not mistaken.
In fact, at our center, we have done more than 6,500 surgeries. And
Yes.
now we are thinking of starting to follow up these cases so that from cleft to confidence, how they have achieved confidence in their life in patients who were operated earlier at KGPCH center.
So we now open the forum for any other questions.
How many these palatal surgeries for taking care of speech problem we have been able to do?
Sir, excuse me, sir. How many pellet surgeries?
Or taking care of speech problem?
Okay,
So,
sir.
uh,
So we normally operate around 300 cases almost every year, out of which almost there are 125 or so cleft palate cases, and some 10% of them would definitely need secondary surgeries because of the short palate even after repair of the surgery. So right now we recently started video fluoroscopy and everything for only last year. So currently we have a waiting of about 80 children who are ready and willing to undergo this surgery. So we are gradually taking all of them, because before surgery we have to have investigations and we have to do speech recording, and after surgery we have to provide them speech therapy. This is really time consuming job for the speech therapist also.
So, sir, being a community medicine professional, we used to learn about the Rashtriya Bal Swasthya Karyakram and the school health programs run by the
Yes,
government.
yes.
And so, as a part of it, they do go for screening for defects and deformities, congenital deformities. So, do children who are identified from the community get referred to this program?
To one of the Smile Train centers. There are 9 centers in Gujarat now. In the central Gujarat, we have only KG Patel Children Hospital. There are one in Kutch, there are 2 in Surat, 2 in Rajkot, and a couple of in Ahmedabad, 1 in Mehsana. So all in all, some 8 to 9 centers are there. So all RBSK doctors, they go to the field whenever they identify cleft patient, they send it them to us. And even sometimes when the patients are poor, they are in such a remote area that for them travel itself is an issue. At that time, we send our vehicles to collect the patient from their village, and after the treatment, our vehicle goes to drop them off to the village. So these are the services that we provide.
Okay, thank you so much, sir. If do we have any more questions? Any other comments? If not, then we can end the session for today. Thank you so much, Hiren sir, for such an insightful session. I personally really enjoyed it because it was very informative and one of a very interesting sessions, especially with all the videos and the real life stories that you shared. Thank you so much, and we shall look forward to meet the club next week again. Thank you so much.
Sure. Thank you so much for inviting me. It was a great experience again. We'll continue to be interacting here again. Okay. Thank you. Thank you.
Thank you. Bye, and thank you all.
Bye. Bye.